Welcome to Be Well. I'm Lisa Bragaw, pharmacist, yoga teacher, and health coach. Each week, we'll explore simple, science-informed ways for us to move better, feel more resilient, and feel more at home in our bodies. From breath work and strength training to sleep, hormones, and healthy habits, we're here to help you age well and truly thrive, one small step at a time. This is Be Well. Hi, it's Lisa Bragaw, and I am here with my friend Manali Kadam. She's a physical therapist who specializes in pelvic floor health. And as a yoga teacher, it's really funny because we talk about the pelvic floor, engaging the pelvic floor, and people don't know what that means. So I'm really happy to have you here today to explain a little bit more about pelvic floor health and how it affects so many people, and to just dispel some myths, and also just to hear a little bit about your journey. So if you don't mind just giving us a little background on how you became a physical therapist and how you've really changed your focus on what you do.
Of course. Well, firstly, thank you for having me on the show, Lisa. I am so happy to be here. Well, my name is Manali Kadam. I am a physical therapist. I have been practicing physical therapy since 2011. It's been a while. I am a board-certified orthopedic physical therapist and have been in the southeastern Connecticut area since 2014. And interestingly enough, during COVID, when a lot of interesting things happen, good or bad, to a lot of people, it happened to me too. So I have a very good friend of mine who is a childbirth educator. Right? And she reached out to me, and you know how during COVID, people had such a hard time reaching out to their healthcare providers.
Yes.
There was just such lack of access.
Yes.
So she reached out to me and was like, well, I have a few patients, and they think they need pelvic floor care, but it's also low back pain and a lot of orthopedic kind of pain. Would you see them and maybe then triage them? And if they need pelvic floor care, you can send them out to so-and-so. And I thought that was a great model, right?
Yes.
So I started seeing people, they were postpartum, pregnant women. I was seeing them at that time just for orthopedic, right?
Okay.
And then as I saw them, if I teased out some pelvic floor issues, I was triaging them and sending them to pelvic floor care. What I found during that time is that I actually really enjoyed working with this population. So I spoke to some of my colleagues, I did a little volunteering, and then finally I was like, you know what, this is what I want to do, right? So pelvic floor therapy in general, it's a postgraduate specialization, right? So you have to do advanced courses to be able to practice that effectively and safely. And that's what I did. So I took a number of courses. It's just not one course.
Right. So it's a lot of work.
It's a lot of work. And
well, you have a lot of knowledge.
Thank you. So I did a number of courses to be able to treat different populations for pelvic floor. So
Great.
Yeah, so that's how I became a pelvic floor therapist.
And I think that's so important because there's not very many of you out there.
Yes.
And there's a huge need for it. So we'd like to dispel some myths today about, first of all, what is the pelvic floor?
Yes.
So if you could tell us a little bit about what the pelvic floor even is.
Yeah.
It's not just one muscle, it's layers of muscle.
No.
And I love that you have your model. I love this model here that can just give you a little bit of a visual to it too. So
yeah. This is my trusty little model here. So our pelvic floor muscles are a basket of muscles, right? And you see this little nice sling here? They go from your pubic bone to your tailbone and to each side, right? And they form a sort of a sling for our pelvic organs, and they support our pelvis, right? So what goes in there is it supports our bladder, our bowels, and our, for women, their uterus and the ovaries, right?
Right.
So it has...
And your organs above that.
And your organs above that.
Because gravity pulls things down.
Of course, yes. Everything supports.
It's a bowl.
It really supports everything there, right? And the pelvic floor muscles have 3 openings, right? So it has your urethral sphincter for peeing, right? It has your anal sphincter for poop, and it has your vagina for females. Through which you menstruate, use it for intercourse. So think about when there is pelvic floor dysfunction, it affects the functioning of all of those organs that we mentioned.
Right.
So yeah.
And I know you specialize in women's care.
I do.
But men have pelvic floors too.
They do.
And there are pelvic floor specialists for men as well. So we're going to discuss a little bit today about what symptoms probably should warrant seeing a professional, and maybe some exercises, little tips that you might give to people that,
Certainly.
And also, what kind of symptoms are there? Like, it's not just a lot of people that I know of, like I when I'm teaching fitness classes or yoga classes, people, if we start to do jumping jacks, all the women who've had babies run out of the room because they have to go pee, and they think that they have a weak pelvic floor. But that's not always the case, is it?
No. So pelvic floor therapy really is for all women throughout their lifespan, right? So whether it is a teenager at menarche, right, at puberty, or all the way to menopausal women, right? Everybody can present with many or different symptoms of pelvic floor dysfunction. Right. So some of the common pelvic floor dysfunction symptoms are, there is urinary leakage, gas or bowel leakage, there is urinary frequency, urgency, that is wanting to go to the bathroom a lot, very frequently. Think about not being able to empty your bladder or your bowel completely, or difficulty emptying your bowels or bladder, right? There can be pain. So pain can be, think about pelvic pain. There can be pain or difficulty with sexual intercourse. There could be pain inserting a tampon. There could be pain with a gynecological exam. Right? It can also present as hip pain or low back pain. And that's something you don't think about. So if you have hip pain or low back pain that persists, and you've gone to therapy, you've done other things, and it's something that's not going away, it could be because of pelvic floor dysfunction. So these are some of the symptoms that can be a part of pelvic floor dysfunction.
It's so interesting too, because I don't think people realize how connected everything is. Like, our body really is, there's no beginning or end to our bodies. It's all a big woven, beautiful tapestry. And so that pelvic floor sling that you're showing here is not showing the rest of the muscles that, that attach to the pelvic bones, and then the hip flexors and the abdominal muscles. And so there's a lot going on there. I loved that you were saying that it can present in so many different ways. So when should somebody seek professional help? And how do they get referred to you? Do they need to be referred to you?
I think if you have any of the symptoms that we mentioned, right? I think what happens really is, if you put 20 women together, right? Like you say in your class, right? How many women really have urinary leakage when they exercise, right? And they talk about it. But unfortunately, they all think it's normal, right? These symptoms are common. But what people don't understand is common doesn't mean normal. Right? So if you have any of these symptoms, may it be leakage, pain, dysfunction, if you have symptoms that are affecting your life, your lifestyle, if they cause you to avoid social circumstances, right? If you are avoiding things because of pain, because of some kind of dysfunction, well, that means you need care, right? And you don't need to suffer in silence. So there's care available for it. So, ask your medical provider, go to your pelvic floor physical therapist, and there is care available for it.
I love that. I remember when I was in pharmacy school, we were doing incontinence. We were talking about incontinence medications. We were talking about pads and things like that. And we were guided to talk to the patients and say it's not a normal part of aging. And I think that if you go to the grocery store, you go to a pharmacy, there's aisles and aisles of pads and of incontinence products, and there's tons of medications, and they come with side effects and risks, right? So I think it's really important for people to know that it's not necessarily normal, and although it's common, like you said, doesn't mean that it's normal, and that there's help, and I love that. What is the process of being referred to? Do you have to get a referral from a medical doctor? And I know it's not covered by insurance.
I mean, I'm an out-of-network provider. Right. In the state of Connecticut, I do not need a patient to have a referral to start therapy. But what we do is we do contact your provider to get a referral for continuing care.
And then there's a dialogue with our caregivers.
Of course, and then there's always that continued care between different providers. So if we need to we refer back, we refer to somebody else. It's a very involved evaluation when you do come to pelvic floor physical therapy.
So tell us a little bit more about that. What does the first visit look like? And I know we've talked about this before, because sometimes you'll do internal exams, but that's not required.
It is not.
And it's not necessary, but it's very helpful.
Yeah. So we'll talk about all of that.
Yeah.
So at my practice, your evaluation and your follow-up all are an hour long, right? In general, pelvic floor therapy is we provide a lot of thorough care for our patients. So in that first evaluation, there's a really long dialogue with our patients about, okay, what are your symptoms? Detailed history, right? When did your symptoms start? What does your lifestyle look like, right? What other social factors are affecting, or other physical factors that are affecting some of your symptoms, right? With the physical exam, we do like a detailed exam about, okay, how does your posture look? How's your breathing pattern? How's your movement pattern? We look at their core strength, their lower extremity strength, and then we put all of this together to come up with a very detailed plan of care. One of the tools that we have that are different as a pelvic floor therapist is that we're trained to do an internal exam, right? Which looks like your gynecological exam, but we do different things, right? So we're looking at the tone of your pelvic floor. We're looking at the muscle strength, how well you coordinate those muscles, whether there's coordination, whether, more importantly, can you relax those pelvic floor muscles. But this is done only if necessary and with consent. Right? Do we get a lot of information from the internal exam? Yes. But I think first and foremost is our patient's comfort, right? And if they're uncomfortable with it, well, there are many other ways to do that, to do different things and find the correct plan of care.
And help the patient.
And help the patient,
Yeah. I mean, think about it. The muscles, they are internal, so to get to them. And if you had an injury in your shoulder, you would palpate those muscles.
Yes.
So it makes sense. I feel like our culture is a little bit more, especially in the Northeast, we're a little more puritanical and shy. My understanding, and maybe you can elaborate on this a little bit more, is in other cultures, like if a woman has a baby, immediately there's a pelvic floor specialist there that's helping her retone those muscles and pull things back together. Where in our culture, we don't talk about it until there's a problem.
I think it's awareness, really. The more awareness that people have, the better it'll be. I mean, at this point, everybody expects an internal exam when they go to an OBGYN, right? So nobody's shy there, right? Because that's what you go in expecting. So if there was more awareness about women going to pelvic floor health, and this is what's there, if we set the standard of health there, then there won't be that shyness. So I think it's just about, I think it's time and us talking about it, right? That brings the level of healthcare there where women are not shy about it. It's something that's expected, and it's something that we all deserve.
We do, and it's part of our bodies, And again, men have pelvic floors too, so it's gravity too. It's the base of the pelvis.
Exactly.
And I love that you talked about assessing people's breathing, because like the diaphragm's like the cap. I think of it like a hat, and then the pelvic floor is like the bowl, and then the wrapping around your abdomen, it creates like a capsule that holds our internal organs together. And so with gravity, just walking around, if the muscles are too loose or too lax, then we're gonna have pressure. If they're too tight. And I do love this, because you've shared this in workshops before. I love when she does workshops at the studio, by the way. She's doing one at the end of February 28th, right?
28th February, yes.
Yeah, and so, it's just so informational, and we do practices, so you can practice relaxing the pelvic floor, practice engaging the pelvic floor, besides just Kegels.
And that's why breathing is so important, right? So part of breathing is really relaxation. We are so stressed in our days, right? We're trying to be efficient, we're trying to juggle multiple things, and that brings stress. And I love this, I'm gonna say this here, but our pelvic floor is like an emotional muscle, right? It's very in tuned with our nervous system. So when we're stressed, when we're anxious, or if our body's gone through trauma, it guards, right? Just like we hold stress in our necks, in our jaws, our pelvic floor tends to hold stress, right? And when it does that, it's tight, and then you're gonna have some pelvic floor dysfunction along with it. So I think the first start is relaxing in that deep diaphragmatic breath, where you're sort of just breathing and letting go.
And that does stimulate a relaxation response in the body. Many people don't. I didn't learn to breathe with my diaphragm until I was, well into my career, because I was so stressed out. I think I breathed to my collarbones, and it just made me stressed out all the time and more anxious. So even just that awareness of breathing into the diaphragm. Now, this is our respiratory diaphragm, but the pelvic floor is really a diaphragm as well. And we have I've seen this in anatomy trainings I've done, where like the arches of your feet are the first diaphragm, and then the pelvic floor, and then the respiratory diaphragm, and then we've got, through the throat and into the head. We've got all these different levels that keep pressure naturalized in the body, appropriate amounts of pressure. And so too much pressure on the pelvic floor can cause what?
So here, it can cause a lot of things. But think about it as the pelvic floor is the bottom, right? And like you said, the diaphragm's on top. A lot of pelvic floor therapy is really pressure management, right? Doesn't matter how strong your pelvic floor is, right? If you're going to hold your breath and strain day in and day out, there's only so much it can take.
Right.
So even in therapy, it's not just strengthening we're doing. We're teaching people that pressure management skill that's going to help you use and utilize your pelvic floor and take the strain off it a little bit.
Yeah. So what are some common things that people do that they think is helpful? I know, I love this. Kegels is not pelvic floor physical therapy. Because I think a lot of people feel that the only pelvic floor work is Kegels, and that's and you could explain what a Kegel is. So I don't know that everybody knows what a Kegel is, but it's a part, but it's not all of it. And I feel like that's the only thing that gets attention in general.
Yes. So to people who don't know what a Kegel is really just a pelvic floor contraction. It's a name given to the exercise, and it's just that little squeeze of your pelvic floor and lift, right? But
not a clenching.
Not a clenching.
Which is what I think most people try to do,
Yes, so when you ask them to do it, they're like really squeezing, clenching their legs and clenching their buttocks, but that's not what it is.
Right.
It's a very isolated pelvic floor, little squeeze and lift. So when you contract, that's how it feels like. It feels like you're lifting up and squeezing a little bit, right?
That's why I think this model is so helpful, because you can almost imagine that the muscle pulling you up.
But that's one exercise in isolation, right?
But that would be like doing bicep curls only and never stretching your bicep.
And what if your bicep is tight? Right. And it's painful because it's tight and it's guarded, and now you're just kind of doing
never
more.
Stretching
and you're never stretching it out. So, which is why individualized evaluations are so important, right? You could have pelvic floor dysfunction and multiple symptoms that could be because of weakness or could be because of tightness. How do you know? Right.
Because the symptoms could be very much the same.
They could be similar, right? And then, so when you go to a pelvic floor therapist and when they examine you, well, you find out, okay, well, there is weakness or there is tightness, right? If there is just weakness that we're working with, we start with really breathing first, right? Of course, we educate on how to contract and do a Kegel, right? But how much of life is laying down?
Right.
So there's a lot of function.
And again, that pressure management, because we're standing up, gravity is going to be a big component. So creating that management of the pressure is super helpful.
So there's a lot of we progress through therapy, taking that Kegel, but in different functional positions. So then you can go back to life exercising and playing with your kid and doing all the things that you want to do. And plus, then if you do have tightness, what next? We don't give you a Kegels, right? We're focusing on relaxation of that pelvic floor, right? We're working on manual therapy to relax the muscle. We're working on cues and breathing, some mindfulness, big way. It goes a long way. But then really taking that and getting that tone to come down, right? Those overactive muscles to relax. And once that's relaxed, tight muscles don't necessarily mean strong muscles. Right. So we might find out that there is some underlying weakness, right? There's some underlying imbalance.
And there are layers of muscles too, right? So you could have some variations in there. Tightness of some and looseness or weakness in others.
But it also works in conjunction with your core and your back, right? So it could be, or your hip muscles. So it could be your pelvic floor could be compensating for lack of strength in all of the other muscles. So it's really finding that balance and working on that, with that person as a whole. not just the pelvic floor.
And I love that too. So the whole person.
Yeah.
Like that's what I call a holistic approach, is
Yeah.
the whole person and all the different remedies and therapies and modalities available to us, and seeing the person as an individual.
Yeah.
And I love so much that you do that.
Yeah.
And I also love that you will do some group classes to give a kind of general overview of understanding, so people can actually start to feel what their pelvic floor feels like.
Yeah.
I know I've had people say, oh, a Kegel is like trying to pee and stop yourself midstream. And please don't ever do that.
Please don't ever do that.
But I know people will do that and they think that's therapeutic.
Yeah.
So can you explain why that's not therapeutic, and please don't do that?
Yeah, we don't want you to stop your urine mid-flow, right? That's not something. We want you to empty that bladder and really relax and let go, right?
Yeah.
The best way I can explain how to engage or do a Kegel is imagine you're sucking a smoothie with your vagina and letting go.
Yeah.
Right? Like you're sucking a smoothie through
smoothie,
your vagina.
a thick drink.
A thick drink. Yeah.
Through a big straw.
Through a big straw. Right? So it's that motion. It's that going up and relaxing.
Yeah.
Right? Like you're sucking a smoothie with your vagina and down.
Right.
Yeah, that's a Kegel.
And it's hard to coordinate. So
It is hard
the
to coordinate.
practice is, and learning appropriately how to do it.
Yes,
I
because
think
what's
is super
most
helpful.
important, and not just contracting, it's being able to relax completely.
Yeah.
A lot of people, because there's tightness, they're able to contract, but they're not able to let go.
Right.
And we need that pelvic floor to relax, to do many things. You need that pelvic floor to relax, to pee, to poop, to birth the baby.
Yeah. So explain a little bit more how it affects urination and having a bowel movement. Because we've talked about this before in some of the workshops you've done, and sometimes it's weakness, sometimes it's tightness. Like if you laugh or you jump or you cough, and that might cause a little leakage. And you've explained to me before that sometimes that's because it's too tight and it's got no place to go, and sometimes it's too loose. So, if you can explain more about that.
Yeah, so if there is pelvic floor weakness, you could have symptoms like incontinence, which is leakage, right? And incontinence presents as multiple different things, right? It could be stress incontinence, which is leakage when you're jumping, leakage when you're exercising, when it's extreme leakage when you get up from a chair and sit down. So there's varied symptoms of how they could present as, depending on how weak they are, right?
Yeah. And that can really prevent people from doing a lot of activities. They really miss out on a lot of life activities.
Yes, I mean, they're using, they tend to use pads, and then a lot of people, there's shame attached to that, right?
Yeah.
So I think it affects people, and they don't want to go places where they think that, oh, I don't have access to this, or I don't have access to a bathroom.
Or they're going there and they're like an emergency exit, finding where bathrooms are as soon as they get there.
It's a very psychosocial kind of effect on it.
Yeah.
With tightness, a lot of times women have what we call as urge incontinence frequency, right? So this really strong urge to go pee, like you'd pee your pants, right? And with maybe even just a little output, like you probably don't have a lot of output, right? And increased frequency, where you go about every 2 to 4 hours, right? But here you're going more often, right?
Or you're forcing it, like you don't really have to go, but you're just in case. You call it just in case.
I call it
peeing.
just in case pee, right? So what happens with women when you have that urge, right, where you're like afraid I'm going to pee my pants, what starts happening is we say, okay, you know what? I'm going to the store. What if I have to really urgently pee there? I don't want to go to the bathroom there. So I'm going to just in case go pee and push, or not have the urge but still go and pee. And the thing is, we don't want to do that. If you do not have the urge to pee, don't pee. What you're doing if you do that is you're training your bladder to hold small amounts of pee. So now you're making your urgency symptoms worse.
Right.
Because now instead of going every hour, you've trained your bladder to go every half hour. Right? So you're making your urgency symptoms worse by doing that just in case pee.
Right.
So that's something you definitely don't want to do.
Right. And then about how it affects the bowels, and talk a little bit about the squatty potty. Because the squatty potty is so funny. When it first came out, there was a really funny video that came along with it, and it had like a unicorn making ice cream.
But
it's hysterical.
Squatty potty,
but the squatty potty
ads.
is really putting us in proper alignment.
Yes.
So can you talk a little bit about that?
Yes. So proper posture for going to the bathrooms to empty your bowels is really, really important, right? And I always tell people, get a squatty potty, get a stool, right? Prop your feet up, lean forward a little bit. That position is the optimal to relax your pelvic floor.
Yeah.
Right? And when you're pushing to empty, don't hold your breath. You don't want to strain to empty
That
your
increases
bowels.
your blood pressure, increases pressure into your eyes and into your head. Yeah.
And that causes more pelvic floor strain than running or jumping. Because if you're a chronic constipated person, and if you're straining day in and day out, that's a lot of strain on that pelvic floor. So that position where your feet are
And it's
up,
uncomfortable.
it's uncomfortable. Yeah. So as you push, think about you're in that feet up, right? Leaning forward, and you're exhaling as you're pushing out.
So I
you're
want you
not
to
holding
share your
breath.
Instagram handle, because she did the cutest video recently about how to use the squatty potty.
Yes.
It's really, really
Just
cute.
good posture
So
on
follow
the
her on Instagram, because she's great. She does lots of really great content.
Thank you.
What is your Instagram handle?
It's Tricore PT and Wellness. I'm on Instagram and Facebook.
Yeah.
So you can follow me there.
Yeah. And it's been showing up on the screen already, and I'm sorry because I didn't ask you about your website and your email contact information, but it's on the screen too. So it's Tricore Physical Therapist and Wellness is the name of your company.
Yes.
So the website is tricoreptandwellness.com.
Yes.
Yeah.
Yep.
And so how do people find you besides they can email you, they can check out your website. Her website, by the way, is phenomenal, so I would check it out. There's lots of great information on there.
And there's a contact form on my website. So my website is www.tricoreptandwellness.com. If you go on it, you could contact me and send in a form, and I will call you as soon as possible, within 2 to 3 business days.
That's wonderful.
Yes.
That's wonderful.
And honestly, Facebook, Instagram is a great way of, if you want to comment on some of the content, if you want to message us, again, we get back to you really soon, within 2 to 3 business days.
And then as far as where you're located?
In Waterford at Crossroads. So yeah, very accessible to our local area. It's right off 95.
Yeah, it's really accessible. It's
Yeah.
right off 95 and not far from 395. So
No. Yeah.
That's wonderful. And do you have any parting words you would like to share? Like what kind of pearls would you like to share with the viewers today?
Yes. I think takeaway should be no just in case peas.
That's a good one.
Right? Try not to strain when you're peeing and emptying your bowels, right? So good posture, leaning forward, exhaling, just letting go, really. You don't want to try to power pee. I think women are notorious to do that. They're efficient and want to get going.
Yes.
Right? So just kind of relax.
Yes.
And really, a lot of these symptoms may be common, but they're not normal. So if
Can you give us a quick review again of some of those common symptoms?
Yes. Urinary, bowel, gas, leakage, an inability or difficulty emptying your bowel, your bladder, pain, right? Pain in the pelvis, pain with sexual intercourse, pain with inserting a tampon, pain with a gynecological exam, or difficulty with it.
And at any age?
At any age.
Yeah.
It can show up early, when just at puberty, just at menarche, right?
Yeah.
Or it could show up at menopause.
Yeah.
A lot of women can have some pelvic floor tightness then,
Right.
some pain with sexual intercourse then. And people don't want to talk about it, but again, it's something that is treatable, and pelvic floor therapy helps with that along with other care.
And that you don't have to suffer.
You don't have to suffer.
No.
Yeah, these symptoms are common, but they're not normal. So ask for help.
I love that.
Yeah.
Thank you so much for coming
you for
today.
having me.
Yeah, and for making this just a little bit more accessible
Yes.
and understandable and relatable. So I think this is really wonderful, and hopefully it takes some of the stigma and the shyness out of discussing the pelvic floor. And if you're ever in a workout class or yoga class and someone tells you to engage your pelvic floor, you're not like, I don't know what that is.
Yeah.
So now you have a little glimpse of maybe what that is.
And if you want to attend our workshop, it's going to be on February 28th.
Yeah, February 28th at 1 o'clock at Zen and Now. Manali will be there doing a general pelvic floor workshop. Sometimes we do them specializing around menopause and menopausal symptoms. So, but this next workshop is just pretty much a general pelvic floor overview and some exercises. And she makes it really fun. It's really wonderful.
And just talking about all the symptoms and answering everybody's questions. I think the question and answer is the majority of it. People get a lot out of it because everybody's just asking such good questions.
Totally. Yeah. And the questions that you think that your a weird person for thinking or for experiencing, and you think you're the only one, and then you hear other people go, oh my gosh, me too.
Yeah.
So I really feel like it's so helpful.
About it.
Yeah,
Yes.
it really is.
Yeah.
And it's something there's help, and you don't have to suffer, and you don't have to, go it alone. So if you're concerned about any of those symptoms that Manali's discussed today, go ahead and contact you and make an appointment with her or a consult.
Yes.
So again, thank you so much for coming and discussing this really important topic. I hope that you got something really valuable out of this and something that you can bring into your day, or a question that you had answered, and that you find that this was helpful as well. So again, you can follow her on Instagram and Facebook, or go onto our website. And I hope you have a wonderful week, and be well. Good job. Thank you.
Thank you for joining me on Be Well. I hope today's conversation inspires at least one simple way for you to support yourself. Before you step back into your day, pause and choose one uplifting action you can gift yourself. What's your one thing going to be? Remember, small, consistent steps create meaningful change. Until next time, take a breath, take care, and be well.